The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, male hormone replacement therapy. More and more men across the U.S. are going in to see doctors, integrative medicine doctors, for bioidentical hormone replacement therapy. And of course, we have San Diego's expert and probably the best shaped medical doctor that I've ever met, Dr. George Weiss. Dr. Weiss, welcome to the program.
Thank you.
All right. For people that don't know you, tell us a little bit about your practice. I mean, who's the typical patient? Who goes to see you?
I have what is called an integrative practice, and I have both men and women. Men are becoming much more interested in preserving themselves.
So these men, they come in 50, 60.
Yes.
They sit in front of you. I mean, what's their main concern? What do they want?
Forget the 50 and 60. We have men as young as 30 to 40 years old who are coming in already complaining of being tired, exerted, their muscle mass is not what it used to be, and the problem may or may not be hormonal decline. It depends on the individual.
Let's talk about the commonly replaced hormones. Mm-hmm. Okay, so a man goes to you, you've done the blood work or saliva or whatever. What are the commonly replaced hormones in men?
Well, the most common would obviously be testosterone.
Okay. How does a man know if he has low testosterone? What are the symptoms?
Well, typical symptoms would be loss of energy, noticing that they're starting to put that little tie around the middle.
Thyroid, and we haven't talked about thyroid. What role does thyroid play?
Well, thyroid is the metabolic hormone, obviously, and it has to do with energy, has to do with weight loss, and actually a low thyroid can be indicative of some other hormonal imbalances. So if your thyroid is not functioning properly, all of the other hormones are not functioning properly.
You know, I know you address sleep, so you get people sleeping again. Tell me about that.
Well, it's important. The most significant thing is to be able to have a good night's sleep. As a matter of fact, when you sleep enough, certain hormones are produced. So if you can get enough sleep, then all of these other hormones are properly balanced out, or at least more balanced out, and you don't have hormones fighting the good hormones, the bad hormones fighting the good hormones.
So doctors will watch this show, and what do you want them to know about what you're doing?
Key to what I try to do is to be more proactive, more preventative. Hopefully not to get them to the point where they have to have a disease, and that's when we start to treat them.
You're watching The Wellness Hour, leader of medical news and information. I'm Randy Alvarez. If you would like more information about Dr. Weiss, you can go to our website. In our search, just put in Dr. Weiss or male hormones, and you'll find him there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.